Psychological Rehabilitation. 1. Introduction to Psychological Rehabilitation. Definition and overview. Psychological rehabilitation refers to the process of restoring psychological well-being and functioning following mental illness, trauma, or other significant life events. It involves a range of therapeutic interventions designed to help individuals regain cognitive, emotional, and social skills that may have been impaired. Importance of psychological rehabilitation. The impact of psychological rehabilitation goes beyond individual recovery. It also affects families, communities, and society at large. By helping individuals reintegrate into society, psychological rehabilitation reduces the burden on healthcare systems and improves overall quality of life. Historical development. The field of psychological rehabilitation has evolved from traditional therapeutic approaches to more integrative and person-centered methods. Key milestones include the deinstitutionalization movement, advancements in cognitive behavioral therapy, CBT, and the development of community-based mental health programs. 2. Theories and models of psychological rehabilitation. The biopsychosocial model. This model emphasizes the interplay between biological, psychological, and social factors in understanding and treating mental health conditions. Psychological rehabilitation often incorporates this model to address the complex needs of individuals. Cognitive behavioral approaches. CBT is a cornerstone of psychological rehabilitation, focusing on changing maladaptive thought patterns and behaviors. Techniques such as cognitive restructuring, exposure therapy, and behavioral activation are commonly used. Psychodynamic approaches. Rooted in Freudian theory, psychodynamic approaches explore unconscious processes and past experiences that influence current behavior. In rehabilitation, this approach can help individuals gain insight into their psychological challenges. Humanistic approaches. Humanistic psychology emphasizes personal growth, self-actualization, and the individual's capacity for change. Techniques like person-centered therapy and existential therapy are often integrated into rehabilitation programs. Integration of different models. Many rehabilitation programs use an eclectic approach, combining elements from various models to create a personalized treatment plan. This integration allows for a more holistic and flexible approach to rehabilitation. 3. Psychological rehabilitation in different contexts. Rehabilitation in mental health disorders. Psychological rehabilitation is crucial for individuals with conditions like depression, anxiety, and schizophrenia. Programs often include therapy, medication management, and support groups to help individuals manage symptoms and improve functioning. Rehabilitation in substance abuse. Substance abuse rehabilitation focuses on breaking the cycle of addiction and addressing the underlying psychological issues that contribute to substance use. Techniques such as motivational interviewing, CBT, and relapse prevention strategies are commonly used. Rehabilitation in traumatic brain injury, TBI. Psychological rehabilitation for TBI involves cognitive rehabilitation therapy, CRT, psychotherapy, and occupational therapy to help individuals regain cognitive and emotional functioning after injury. Rehabilitation in chronic pain. Chronic pain often has a psychological component, and rehabilitation programs aim to address both physical and emotional aspects of pain. Techniques like biofeedback, relaxation training, and CBT are used to manage pain and improve quality of life. Rehabilitation in neurodevelopmental disorders. Individuals with conditions like autism and ADHD often benefit from psychological rehabilitation that focuses on improving social skills, communication, and emotional regulation. Applied behavior analysis, ABA, and social skills training are commonly used. 4. Psychological rehabilitation techniques and methods. Cognitive rehabilitation therapy, CRT. CRT is used to improve cognitive functions such as memory, attention, and problem solving. It is often used in rehabilitation for brain injuries and neurodegenerative conditions. Cognitive behavioral therapy, CBT. CBT is widely used in psychological rehabilitation to address a range of mental health issues. Techniques include identifying and challenging negative thought patterns, exposure therapy, and behavioral activation. Psychotherapy and counseling. Various forms of psychotherapy, including psychodynamic therapy, humanistic therapy, and integrative approaches, are used in psychological rehabilitation to help individuals process emotions and develop coping strategies. Family and group therapy. Family and group therapy are often integral to rehabilitation, providing support and improving communication among individuals and their loved ones. Family therapy can help address systemic issues, while group therapy offers peer support and shared experiences. Mindfulness and relaxation techniques. Mindfulness-based interventions, MBIs, and relaxation techniques, such as deep breathing and progressive muscle relaxation, are used to reduce stress and improve emotional regulation in rehabilitation. Behavioral activation. This technique involves encouraging individuals to engage in activities that are rewarding and aligned with their values, helping to combat depression and improve overall mood. Medication management. Medication is often a key component of psychological rehabilitation, particularly for individuals with severe mental health conditions. Medication management involves regular monitoring, adjustment of dosages, and addressing side effects. 5. The role of multidisciplinary teams in psychological rehabilitation. Role of psychologists, psychiatrists, and counselors. These professionals provide therapy, medication management, and psychological assessments, forming the core of the rehabilitation team. Role of occupational therapists and physical therapists. Occupational and physical therapists help individuals regain functional skills, such as daily living activities and mobility, which are often impacted by psychological conditions. Collaboration with social workers and family members. Social workers assist with accessing resources, coordinating care, and providing support to both individuals and their families. Family members are also key partners in the rehabilitation process, providing emotional and practical support. The importance of personalized treatment plans. A tailored approach is essential in psychological rehabilitation, as each individual's needs and goals are unique. Multidisciplinary teams work together to create and implement personalized treatment plans. 6. Challenges and barriers in psychological rehabilitation. Stigma and misconceptions. Mental health stigma can prevent individuals from seeking help and hinder the rehabilitation process. Addressing these misconceptions through education and advocacy is crucial. Access to care. Limited access to mental health services, especially in rural or underserved areas, is a significant barrier to psychological rehabilitation. Teletherapy and community-based programs can help bridge this gap. Financial and resource constraints. The cost of psychological rehabilitation can be prohibitive for many individuals. Insurance coverage, government programs, and sliding scale fees can help mitigate these challenges. Cultural and social barriers. Cultural beliefs and social norms can impact an individual's willingness to engage in rehabilitation. Culturally sensitive approaches and inclusive practices are necessary to address these barriers. Maintaining long-term recovery. Sustaining progress after rehabilitation requires ongoing support and maintenance strategies, such as follow-up care, peer support groups, and relapse prevention programs. 7. The role of technology in psychological rehabilitation. Teletherapy and online counseling. Teletherapy has become an essential tool in psychological rehabilitation, providing access to therapy and counseling services remotely. It is particularly valuable for individuals in remote or underserved areas. Mobile apps for mental health. Numerous mobile apps offer tools for managing mental health, such as mood tracking, meditation, and cognitive exercises. These apps can complement traditional therapy and provide ongoing support. Virtual reality and rehabilitation. Virtual reality (VR) is being used in psychological rehabilitation to simulate real-life situations and help individuals practice coping strategies in a controlled environment. It is particularly effective in treating conditions like PTSD and phobias. Wearable devices for monitoring and support. Wearable devices, such as fitness trackers and smartwatches, can monitor physical activity, sleep patterns, and heart rate, providing valuable data for psychological rehabilitation programs. Future trends in technology-assisted rehabilitation. The future of psychological rehabilitation will likely involve further integration of technology, including artificial intelligence, AI, machine learning, and more sophisticated virtual and augmented reality tools. 8. Case studies and real-life examples. Success stories of psychological rehabilitation, highlighting real-life examples of individuals who have successfully undergone psychological rehabilitation, can provide inspiration and insight into what works. Challenges and learnings from real-life cases. Not all rehabilitation efforts are straightforward. Discussing cases that presented significant challenges can offer valuable lessons for practitioners and individuals alike. Different approaches to complex cases. Complex cases, such as those involving co-occurring disorders or severe trauma, often require innovative and multifaceted approaches. Exploring these cases can shed light on the importance of adaptability in rehabilitation. 9. Evaluating the effectiveness of psychological rehabilitation. Measuring outcomes. The success of psychological rehabilitation is often measured through a combination of clinical assessments, patient-reported outcomes, and functional improvements. Tools like the Beck Depression Inventory, BDI, or Generalized Anxiety Disorder 7, GAD-7, are commonly used. Patient feedback and satisfaction. Patient satisfaction is a key indicator of the effectiveness of rehabilitation programs. Surveys and interviews can provide valuable insights into what aspects of the program are most beneficial. Longitudinal studies and research findings. Long-term studies are essential for understanding the lasting impact of psychological rehabilitation. Research findings help refine treatment approaches and improve outcomes over time. Cost-effectiveness and resource allocation. Evaluating the cost-effectiveness of rehabilitation programs is crucial for ensuring that resources are used efficiently. This involves comparing the costs of rehabilitation with the long-term benefits, such as reduced hospitalizations and improved quality of life. 10. Ethical considerations in psychological rehabilitation. Patient rights and confidentiality. Protecting patient rights and confidentiality is a fundamental ethical principle in psychological rehabilitation. This includes obtaining informed consent and ensuring that personal information is kept private. Informed consent. Patients must be fully informed about the rehabilitation process, including potential risks and benefits, before agreeing to participate. Informed consent is an ongoing process and must be revisited throughout treatment. Cultural sensitivity. Cultural competence is essential in psychological rehabilitation. Practitioners must be aware of and respect cultural differences in beliefs, values, and practices, tailoring treatment approaches accordingly. Ethical dilemmas in treatment. Ethical dilemmas can arise in rehabilitation, such as when there is a conflict between patient autonomy and the need for treatment. Navigating these dilemmas requires careful consideration and often consultation with ethics committees. 11. Global perspectives on psychological rehabilitation. Differences in approaches across cultures. Psychological rehabilitation practices vary widely across cultures, influenced by differing beliefs about mental health, healing, and the role of the community. Exploring these differences can enrich our understanding of rehabilitation. Psychological rehabilitation in developing countries. In many developing countries, access to psychological rehabilitation is limited. International organizations and NGOs often play a crucial role in providing services and training local professionals. International collaboration and research. Cross-cultural research and collaboration are essential for advancing the field of psychological rehabilitation. International conferences, research partnerships, and shared resources contribute to global progress. Global initiatives and programs. Organizations like the World Health Organization, WHO, and the United Nations, UN, support global mental health initiatives, aiming to improve access to psychological rehabilitation worldwide. 12. Future directions in psychological rehabilitation. Innovations in treatment methods. The field of psychological rehabilitation is constantly evolving, with new treatment methods emerging from ongoing research. Innovations such as neurofeedback, psychedelic-assisted therapy, and transcranial magnetic stimulation, TMS, hold promise for the future. Policy and advocacy for improved access to care. Advocating for policies that improve access to psychological rehabilitation is essential for addressing disparities in care. This includes expanding insurance coverage, funding mental health programs, and promoting mental health awareness. Training and education for professionals. Ensuring that mental health professionals are well trained in the latest rehabilitation techniques is crucial for the field's advancement. Continuing education, specialized training programs, and certification are important components of professional development. Predictions for the future of psychological rehabilitation. The future of psychological rehabilitation will likely involve greater integration of technology, personalized treatment approaches, and a focus on preventive care. As our understanding of the brain and behavior continues to grow, rehabilitation methods will become more targeted and effective. 13. Conclusion. Summarizing key points, psychological rehabilitation is a dynamic and multifaceted field that plays a crucial role in helping individuals recover from mental health challenges and reintegrate into society. By addressing cognitive, emotional, and social aspects of recovery, rehabilitation programs provide comprehensive support for individuals and their families. The continuing evolution of psychological rehabilitation, the field is continuously evolving, with new research, techniques, and technologies shaping the way rehabilitation is practiced. Ongoing innovation and collaboration are essential for meeting the diverse needs of individuals and improving outcomes. Final thoughts on the importance of ongoing research and development. As the field of psychological rehabilitation continues to grow, it is vital to prioritize research and development. By staying at the forefront of scientific and clinical advancements, practitioners can offer the most effective and compassionate care to those in need. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.